Now, let me
So,
ask you this. I'm so sorry to interrupt, but
yeah,
would you repeat
no
those
problem.
three conditions? I don't have any of them, but I just, for my record, like, what are those three
Well,
called again?
and this isn't. I don't have any reason to believe that these are the only three conditions, but the only ones that are mentioned in the
Just
guidelines
say one.
explicitly are it says the 24-month waiting period for Medicare will be waived if you have amyotrophic lateral sclerosis, commonly known as ALS or Lou Gehrig's disease, or if you have end-stage renal disease, which would is commonly known as kidney failure and
Right,
requires dialysis until you have a kidney transplant.
right.
Or the third category is a bit nebulous. It just says if you've been exposed to environmental health hazards and have been diagnosed with a medical condition due to this exposure.
Hmm.
So I assume that my best guess, if I were hazarding a guess, would be um, exposure to something related to your if you're in the armed forces, but since because it's the Social Security Administration that made that, if you were automatically enrolled, you were enrolled by them, so they should be able to answer why you were enrolled. It doesn't say anything about that on the in the letter.
Okay. Well, I'll do that. I'll reach out to Social Security and see if I can get some more information from them. Um, and in which, as I said, I have what's required by the state, like the VA pretty much covers my health insurance. Um, in which at that time I'd be looking to cancel. Should I just call you guys back and cancel?
Well, what what military coverage do you have?
Um, it's I want to say it's ASST, but it's the VA healthcare.
Okay. Do you know if it falls under TRICARE or CHAMP VA?
I think it falls under TRICARE, if I'm correct.
Well, so um, as I'm sure you know, TRICARE is a healthcare program for uniformed service members, including active duty and retired members and their families, National Guard or Reserve members, surviving family members, the former spouses, Medal of Honor recipients and their families, and others registered in the Defense Enrollment Eligibility Reporting System. If you have TRICARE coverage and both Medicare Part A and Part B because you're eligible by age, then you automatically get TRICARE for life. Um, it the What's notable is if we go to how Medicare and TRICARE work together. Um, Let me see here. Uh, I guess what I'm looking for is um, my understanding with a lot of the military, with some of the military coverage programs, they actually require you to um, have both. Okay, what it says here is you can have both Medicare and TRICARE benefits. In fact, the
Mm.
Department of Defense encourages those with TRICARE benefits to enroll in Medicare when they're first eligible. Some TRICARE plans may work differently with Medicare than others, but we can provide some general guidelines based on whether or not you or your sponsor are on active duty. So if you're not on active duty, um, then your coverage may depend on your specific plan. Generally, um, if you have TRICARE for life, um, Medicare would be your primary payer, and TRICARE would pay secondary. Um, I don't. I'm looking for it here. You would want to at least contact the military coverage because some of those programs require you to um, maintain Medicare Part B in order to continue to be eligible for the military coverage. Now, that may just be one or another of them. to make sure that you wouldn't be forfeiting anything in your military coverage if you, like, say, opted out of Part B.
Right.
And you can do that. I mean, you can, um, generally Medicare beneficiaries receive, if you've worked for 40 quarters, then you have a free entitlement to Part A. And then um, Medicare Part B, there's the monthly premium is $170.10. Is the standard amount for most beneficiaries. If you qualify for a limited income program, the state may subsidize that. But yeah, so a lot of people, some people who have certain types of coverage will opt out of Part B. Um, that's in my experience mostly people who are 65 and still working and have group coverage through an employer. But there could be other reasons to opt out of Part B. So you don't have to take it, but you would definitely want to know what the consequences of declining it were.
Absolutely. Okay. That was very helpful. Thanks for that information. I'll contact social. I'll give you a little bit more information. I'm a veteran. My diagnosis is schizophrenia. So literally, I'm on Social Security because I hear voices. But um, I I tried not to mix the two. You know, I try to keep military and the civilian separate. I don't want to be associated with Medicare in any way. So I just need to make sure, like you said, I'm not, giving up any type of any forfeiting any type of benefit that might be available to me by opting out.
Yeah. What is your, if I can ask, what's your concern about being associated with Medicare?
I've had it before. It's not Medicare as much as it is the hospitals that are available in the state that I'm in. So I'm in Akron, Ohio. The only hospital here is Summa and General. I don't want to go to either of those in the event that something happens. I'd much rather go to Wade Park. And when I do have an issue, like if let's say I catch a cold or something, I drive literally to Cleveland for that. Um, I've had bad experiences at those hospitals, and that's kind of why I don't want Medicaid. Like if I'm planning to move in January, so when I move out of state, it's something that I may consider, and it'll be around that 24 month mark also. But I just don't want to have it while I'm in the state of Ohio.
Okay. Well, and that's, I mean, that's understandable. I do want to clarify, Medicare and Medicaid are two entirely different things. Most people who work, who are United States citizens and who work, for at least 10 years, end up with Medicare when they reach retirement age. Medicare's the larger program. Medicaid it is administered on a federal basis. Medicaid is, as you know, health insurance for individuals who have limited income, and so, and that's, laws vary from state to state
Mhm.
for to qualify for Medicaid, um, but they're and you can also be dual eligible. So you can be eligible in Medicare, or you can be eligible in Medicare and Medicaid. It sounds like in the past you had Medicaid, but I do want to emphasize, Medicare is a completely different program than Medicaid. So whatever you had in the past with Medicaid, there might be some superficial ways in which it looks like Medicare, but Medicare is a separate program from Medicaid. Um, Let me see if I have anything on your file. It's does the letters mention Medicaid specifically?
Let me take a look. Give me one moment. Medicare.
Okay. Well, and so just so you know,
So it
they
doesn't say anything about Medicaid at all. The only thing that's referenced is Medicare.
yeah. Well, so Medicaid is um, be, because it depends so much on, for lack of a better word, the politics and the infrastructure
Right.
of the state that you're in. Um, yeah, there is a wide there's a lot of variation in access of benefits in Medicaid, um, depending on where you're located. Medicare is entirely different. Medicare is composed of Part A, inpatient hospital coverage, and then Part B, outpatient medical coverage. The Part A is premium free if you've worked for at least 10 years and earned 40 quarters, and looking at your Part A and Part B benefits, your Part A entitlement is free. So that would remain so as long as you had Medicare. The Part B is the standard premium amount for Part B is $170.10. Now, if you had, if you were limited income and you qualified for Medicaid, or not even Medicaid, but there are different levels of Medicare savings programs.
Mm-hmm.
Then there some like QMB, QI, qualified individual, or SLMB, specified low income Medicare beneficiary. Um, there are some programs where the state will pay for your Part B premium, but otherwise the the Medicare coverage is most people when they retire, hit 65, go on Medicare.
I'm
It's
38.
so yeah. So I mean, it's you wouldn't be. The other thing is. So with Medicare, providers do have to be enrolled, like doctors, hospitals, and so forth, have to be enrolled with Medicare to submit claims. But I would guess, I'd say many. I want to say most. I don't have actual numbers, but probably most uh, providers are going to be enrolled in Medicare simply because it makes up such a large footprint in the um, healthcare landscape. So, with in original Medicare, we encourage you get Part A and Part B. We encourage you to enroll in a Part D drug plan. But if you had other creditable drug coverage with the military, then you wouldn't need to necessarily enroll in a drug plan. And and then usually it depends on what program it is, but Medicare may be primary to your military coverage. It could be secondary, or there could be circumstances where neither is primary, and the provider could submit the claim to one or the other. Um, but yeah, it's a totally different program from Medicaid.
I
There's
see.
it doesn't really limit you the way that Medicaid does, and uh, certainly, and I I guess in some areas there might be a stigma attached to Medicaid, but certainly there isn't any stigma for any reason attached to Medicare, just because um, when people hit retirement age, eventually most people are going to be on Medicare with very few exceptions.
Exactly. Okay, that makes absolute sense. Let me ask you this right now. You said that I'm eligible for Part A, and it's free of cost to me. And you said, but the Part B that I'm eligible for, that's scheduled to go into effect, there's a cost associated with it for me individually.
Um, yeah, so you know, if you work for 10 years and earn 40 quarters 40 employment quarters with Social Security, then you get the Part A inpatient hospital coverage, premium free, and that's what you have. Um, Anyone who has Medicare, unless you qualify for a Medicaid or a Medicare savings program, anyone who has Medicare will pay the standard Part B premium amount. As of this year, as of 2022, it's
One thirty.
$170.10 a month. Now, if you're receiving Social Security benefits, by default, that would, by law actually, that would just automatically be deducted from your benefit check. Um, and then a lot of, in my experience, a lot of beneficiaries who have military coverage have prescription drug coverage that's adequate through that military coverage, and so they may decline a Part D drug plan. I mean,
Part B.
if you have creditable, what's considered creditable drug coverage that's as good or better than Medicare's, then you could enroll in a Part D at any or a Part D plan at any time without a late enrollment penalty. So a lot of people with creditable drug coverage will not enroll in a drug plan, and then you can always add a drug plan down the road if you want.
Right.
But
Okay, me personally, I don't need the drug plan, but I want to make sure I heard you correctly when you were explaining Part A and Part B. You said that you know there are some instances where people didn't decline Part B. I would like to decline Part B. Are you able to take care of that for me today?
um, you would need to. So let me pull that up. And again, I would highly recommend that you contact your military insurance because there may be circumstances where declining Part B would cause you to lose your military coverage. I don't have all of the guidelines in front of me, and I'd have to know exactly what program that is. But there are some programs that are dependent on maintaining Medicare coverage. But if you wanted to decline Part B, if it's before your effective date, um, you would have received a red, white, and blue Medicare card. There should be instructions on the card that allow you to return that. And I think you have to check off a box on there, but you can return that and decline the Part B, and then they'll send you a card with just the Part A. Um, Otherwise, if you wanted to decline it, or after it becomes effective, you would have to disenroll from it. You have to do that through the Social Security Administration, and I can give you some numbers to contact the Social Security Administration, but I really can't overemphasize the fact that you really want to check with your military coverage and verify whether or not they require Part B.
No, I get that, but I'm saying if I wanted to put it into effect today, just so I don't have to double back. So I'm almost sure that I won't lose anything that's available to me on the military side. And so let's say when I call them on Tuesday, because Monday's a holiday. Let's say when I call them on Tuesday, they affirm what I suspect. Then if it's already declined, I don't have to call back. But if it isn't, then I would have to reach back out to you guys. Um, I will say this
Well,
much: when I got the packet in the mail, like I rejected it. I'm like, this doesn't apply to me, and I threw it away. So I don't even have the information. I don't have the packet, and I don't have the cards. So
okay,
can you also schedule for that to be resent to me? I suppose.
um, I can send out a card and an entitlement letter, and you can. But yeah, so I'll send out the card and the entitlement letter. But what it says, if you don't have it states you can decline Part B during your initial enrollment period if you were automatically enrolled in Part B and your coverage is not yet effective. If
Right.
you wish to decline, you would need to follow the instructions that came with your Medicare card and send the card back. If you keep the excuse me, if you keep the card, your Part B would still be in effect, and you would pay the Part B premiums. If you sign up for Medicare through Social Security, you should contact the Social Security Administration to drop your Part B coverage. Please keep in mind that you may have to pay a penalty if you decline or disenroll from Part B, and then later decide that you want Part B coverage unless you qualify for a special enrollment period.
Exactly.
Once you've been disenrolled from Part B, Social Security will send you a new Medicare card showing your Part A effective date. You should contact the Social Security Administration or the RRB with any questions about special enrollment periods or to sign up for Part B. So if you have, I mean, it's possible that you got coverage that is non-dependent on Medicare, and you can opt out of Part B and avoid paying the monthly premium.
Yes.
Um, and but regardless of whether, so the other important factor is if the coverage that you have is considered creditable coverage and doesn't require Medicare, then you would have the opportunity to pick up Part B later whenever you want to. But if for whatever reason you lost the coverage because I mean for not maintaining Part B or for any other reason, um, if you re-enroll in Part B later, the costs can go up 10% for every 12-month period that you go without Part B. So the cost of it would double every 10 years, and so you would just want to be really sure about
That's not
all of
happening either because all these
the
systems
effects,
about to fall.
because if you didn't have creditable coverage and then enrolled in Part B later and paid a late enrollment penalty, the cost of Part B could be substantially greater.
He must have mentioned over
But yeah, let me
65 so
give you
many
the
motherfucking times
numbers.
that I'm like, they're still trying to call me these old
The
bitches.
main
He said they
number to the
pretty much
Social
enrolled
Security
me
Administration
before I was eligible for enrollment. It was supposed to be 24
is going
months.
to be 1-800.
Oh, I'm sorry. I have their number already.
Okay. Do you have a local number?
I believe in my record I do have a local number because I was speaking with someone. Yeah, I do. I do.
Okay. Yeah. Then um, you, the the standard way to decline is by returning the card. But if you don't have that to return, then you will have to um, get in touch with Social Security and probably submit a written request to decline. But if you give them a call, they can give you instructions on how to decline Part B. You'll have to do that before October 1st. After that, after it becomes effective, then it changes from declining it to being a disenrollment, which is handled differently.
Right. Okay, so you'll send me out a new Part A card along with the letter of eligibility or letter of what? How did you refer to it? It's a letter of.
I well, just I don't want to give you the wrong impression. I haven't really done anything today. I sent out a Medicare card, but you haven't changed your Medicare status, so it's going to be
Exactly.
identical.
No,
It's going to
no.
be
I just want to
identical.
make sure the card is coming. I'm going to contact Social Security personally and have them. I'm going to go through, send a decline through them. I'll contact the VA first thing in the morning on Tuesday, and after I speak with the VA to make sure that I'm not forfeiting anything, like I said, I'll go through Social Security and I'll have them decline.
Okay. Yeah. Then you'll probably get a Medicare card. I mean, the same as the one you received before in the mail. If it's no use, you can just toss that. You probably want to shred it, and you'll also get an entitlement letter, which you can shred as well. Um, but yeah, that's and then I guess the only other thing is if you'd like the number of the state health insurance assistance program, I can provide that. But otherwise,
Sure. Go ahead. I'll take the number. I'll add it to my contacts just in case I need it for future reference.
Okay. So the every state has a SHIP office. Stands for State Health Insurance Assistance Program. They just leave out the A because it makes a better acronym. But the the
I
Ohio
saw that in
Senior,
there. I saw that the State Health Insurance Assistance Program. Yeah, referred to as
yeah,
SHIP. Yeah.
that number is 800
Six three three.
686. Well, it's going to be actually 1-800
Uh huh.
68 and then 686
Okay.
1578.
Okay.
And so, they provide free insurance counseling services to Medicare beneficiaries. They can help you understand your health care options under Medicare, and also they have insight into the health landscape, the healthcare landscape, or health insurance landscape in your state in general. So, if you had any questions about, um, a lot of people go to, who have questions about how benefits work together, or what the best strategy is to, for what health insurance to maintain in order to make sure that they're covered. The SHIP office can provide free counseling on all of those questions.
Okay. Perfect.
All right. Well, I appreciate you giving us a call. I am sorry about the misunderstanding, but yeah,
No, it is
it as
absolutely. I'm sorry. I didn't mean to cut you off. No, that's absolutely fine. I wasn't aware that that's how Social Security operate. I didn't know that that was coming. But you have been very, very, very informative. I do appreciate all the information that you rendered.
and then, I mean, best case scenario. So if you call or if you verify with the military that you'll still have the coverage that you need, and it's creditable coverage, so that you won't face a late enrollment penalty later, then you can opt out with Social Security. That way, you may avoid unnecessary coverage, um, and avoid having that to pay the 170.10 Part B premium. You would still have the Part A. I guess one thing I should add, since you're declining the Part B, is you you don't want to um, opt out of. I mean, you don't want to disenroll from the Part A, because disenrolling from the Part A actually requires.
Pisses off demons.
Let me. Um, I apologize. Let me bring up what the guidelines say here.
Okay. No problem.
Essentially, no one um, disenrolls from Part A, because you have to give up your Social Security benefits, and you have to pay back all the benefits Social Security has paid out already.
Okay.
Um, yeah, it says generally you can only disenroll from Medicare Part A if you're paying a premium. If you have premium-free Part A, you can only disenroll from Part A coverage if you cancel your Social Security benefits. This would require you to pay back all retirement or disability benefits that you have received, and all costs
He's
that
very desperate.
Medicare has
Can't you
spent
tell
for
he
the
has
year.
something right on it? This is an
So,
agent.
just a side note, um, you know, when you're declining the Part B, make sure that you're not,
Declining Part A in any
inadvertently,
way.
yeah.
Okay. Understood.
All right. Well, I appreciate your time today. Are there any other questions I can answer for you?
No, thank you. You've been a great help. I appreciate it.
All right. Well, thank you for calling Medicare. Have a good afternoon.
You too. Bye bye.